All right, we're back. Hi, everyone. Sorry about that, and thanks for your patience. We had a bit of a technical issue, but now we should be able to have... It works this time. Yes, it worked.
Yeah.
Great.
Sorry.
Great that it worked.
Yeah,
Thanks so much, Nele.
I was on my computer and not on my phone, so I had to install it first. So my
Yeah,
apologies for the delay.
sometimes it can be a bit tricky, but thanks so much for taking the time, and thanks for everyone for the patience and for staying with us. And let's get started. I'm really excited about today's topic and to have you, Nele, on our live. You are a super experienced researcher, medical doctor in this field and looking into child gut health. So it's great to have you on board. And today we're going to talk about the effect of medications on the gut microbiome and gut health for children. So we're going to go through the latest science on that and what that means for everyday life. So let's get started. And as I always say, this is a session for everyone that is joining. So if you have any questions, please drop them in the chat. Let's actually start with a question from me. How much do you guys know about the gut microbiome for children and also the effect of medication? That would be great to hear in the comments, and we'll answer any question you have. But let's get started with introduction. Nele, tell us about your background and your research at Karolinska Institute and University of Antwerp.
Yes. As you said, I'm a medical doctor, but I rolled into epidemiology immediately after graduating. And in 2012, I went to Sweden. I did a bit of cancer epi, but then I rolled into the microbiome field as well. And when I started there, I was just doing some studies on drug exposure and risk on cancer. And simultaneously, around the same time, there were some studies popping up as well on impact of drugs on the microbiome. Before that, everyone knew that antibiotics were affecting your microbiome because, yeah, that's obvious. They're supposed to kill bugs. But very little was known about other drugs. And around the time that I then started in the officially in the microbiome field in 2016, the first papers came out, and then they actually showed that another group of drugs, the proton pump inhibitors or PPIs, actually had a bigger effect than antibiotics. And I think that startled a lot of people, and we've been thinking about that a lot since then. And also looking into who uses those drugs. And I think the biggest difference between antibiotics and PPIs is that PPIs are often used by many people on a daily basis. Most indications are that you only use them for like a couple of weeks or like 2-3 months maximum, but many people start, but too few people stop the treatment. And there are a few indications also in small children where they are recommended to be used for longer periods of time. Like if you have a birth defect on your esophagus, you're supposed to take it for at least a year. But there are actually not that many indications that are really known and with efficacy data that they really work for using it for long term. So many people use it. And then to come back to the microbiome, yeah, if you use antibiotics, it's of course bad, but usually antibiotics, you only take them for a couple of days, maybe a week. And in most people, your microbiome will jump back. Okay, it's a bit still more questionable what happens in children because the microbiome is not completely developed yet. But in general, in the majority of the cases, it will recover. But then, of course, if you have something bad happening to your microbiome and you are exposing your microbes every single day for a very long period of time, it actually makes sense that it can have a long-lasting impact, even if you then finally will stop.
Yeah.
And since then, we started with those epidemiological studies, association studies, large-scale studies, and then we started also investigating that in all our microbiome studies at KI, the Karolinska Institute. So we now we are collecting drug information in all our studies because we know it's not enough to look at antibiotics. And we hope in that way also to contribute to the research a bit, like don't only look at antibiotics, look at other things as well, because we don't really realize how much drugs we use. Even people who consider themselves healthy, Well, I think almost everyone, also here in the audience, almost everyone will use drugs on a regular basis. Uh, you know, painkillers, antihistamines, something small, something, and then it doesn't mean that you are like really ill or something, but we just, it's part of our way of living almost to, uh, you know, use drugs on a regular basis.
That's really fascinating, especially because we know now more and more about the gut microbiome and how important it is for health, not only for children, for everybody. And we're really starting to realize that, for example, the pharmaceuticals that are available today
Mm,
have been evaluated for
yeah.
safety and effectiveness, but we haven't considered and looked into much on the effects on the gut
Yeah.
microbiome because not much was known about it
And
in the past decades. So when we evaluate pharmaceuticals today with clinical trials and they're approved, the effects on the microbiome are usually not taken into
no.
account. So now today we're realizing, wow, like we evaluated all of
Mm,
these drugs for many effects on the body, for risk of cancer, for example, and many different things, but we haven't looked into, well, what do they do
mm,
to our gut microbiome, which is part of us.
yeah.
It's not external, we need it to be healthy. So only now we're starting to open this entire field of research. And then, as you say, Nele, nowadays taking pharmaceuticals, especially the ones over the counter,
Yes.
even paracetamol, something for pain, painkiller, it's quite common. I have a
Yeah.
headache or I have something, I take a pharmaceutical, it's safe, it's effective, it's over the counter. But now we're starting to realize, well, those affect our gut microbiome. And if we continue to take this medication over time, they might have even a larger effect. So that's our topic of today. And Nele, you've been also involved in a very large study at Karolinska Institute called SWEMAMI,
Mm,
looking at the gut microbiome, or actually the vaginal microbiome during pregnancy, and the effects on the baby. So you're a big expert in women's health and also maternal health and child health.
yes. And yeah, if I can come back a little bit on what you said before on the trials, yeah, we don't know that much about, how drugs affect our microbiome, but we also don't know that much about long-term safety because
Yeah,
it's a very expensive and long process to get drugs on the market. And of course, you have to have all those different steps, which are, yeah, quite intense and many people are involved. But then once it's licensed, there is actually no, yeah, very few data available to look at long-term effects. And many people presume that, oh, we don't know about any long-term effects because it's not studied, so there are none. So we really need big data. We need to look into it and to see if there are effects. And indeed, yeah, if something is over the counter or like in Sweden, often in the supermarkets even, who is going to read those leaflets? That is
exactly.
that's not recommended, and then indeed you take it because yeah, everyone presumes it's safe. Um,
We also get a lot of questions about vaccines and their impact on the gut microbiome. So I'm going to get back to that question
yeah,
because it's one of the biggest questions that we get. But I would say let's start from the top on what is the gut microbiome, why is it important, and in particular, why is it important for children?
yeah. Well, I like to describe the gut microbiome a bit as a helpful army of good bugs, and we start acquiring them very close after birth. And yeah, during, especially during vaginal birth, you already start ingesting them, especially those first few years of your life. The microbiome in different locations of your body will have to form and, become strong. And like in every, like in an army as well, you need people with different functions. Some will deliver food, some will, do maintenance work. And we need that, especially in the gut, a big variety of bugs. And in early life, yeah, there are many things happening. The baby itself is growing and developing. But then, yeah, it is expected that around age 3, age 5, that you are kind of having a stable microbiome, which is rather stable during life. But yeah, stable is also not that easy to define. But then, yeah, it's now, yeah, last 5, 10, 15 years, we know more and more about how that microbiome in the gut, but also other places, affect our health. And I think it's funny because, yeah, also when I started, I was also a bit skeptical, like, how does it work? But then somehow in our health, in our language, we already know that there's an association for such a long time. We have butterflies in our stomach, or I feel it in my gut. So there is some sort of a link also with brain, with neurodevelopment, with overall health, with stress levels. So there are many ways of how our bugs interact with the rest of our body, directly with bugs in the different places, but also the bugs signaling, actually signaling, sending small messages all over. So yeah, we know more and more that it's really important to have the whole system as a whole in balance. And if you then do something like antibiotics, you will have an infection, for example, an ear infection. Of course, you want to target the bug affecting everything in the ear. But then, the bug comes in all your body. It comes in your blood. It will affect the bugs all over. And then it's also important that you have a good and strong, diverse microbiome all over, that, if that bad thing of the antibiotics passes by, that they can, recover and make it healthy again. But they will be affected. And then, of course, the more antibiotics or the more harmful things you are exposed to, it will be harder and harder for your microbes to, jump back to normal and recover and be strong again.
Exactly. And it seems that the gut microbiome might be even more important in the first years of life.
Yes.
So the concept here is actually that disturbances in the microbiome early on can be associated to problems and risks later in life. What do we know about that?
Well, so that's indeed a thing, and that's also a bit the most worrying thing. It's normal that if something is starting and has to find a balance, that it's more vulnerable. And we do unfortunately know, for example, that we use a lot of antibiotics. Also, especially small babies, if they're born prematurely, they will almost all get antibiotics at a certain time, and certainly other drugs, and they're not in the best natural environment anyway. So there are many things already from early in life who try to disrupt everything. So you have a vulnerable child who is also especially if it's premature or something else not going on optimally, then there are already many things that little body has to go through, and one of the things is the microbiome that has to be established. But then there are many challenges, and one of them, of course, antibiotics and other drugs, they can be life-saving. And now I'm especially talking about also the premature babies. The risk of serious infections is enormous. So then, of course, you need the babies to survive. And that's the same thing. If you have a major infection in the mom, the mom needs to survive. The baby inside her belly needs to survive. That's absolutely crucial. And I think every physician wants to, aim for that. But then, we have a huge gray zone of do we really need those antibiotics? If it's not life-threatening, if there's no real risk of, permanent disabilities. And then I'm more really thinking about, the grown-up with a bit of a sore throat. You have a cold, you feel a bit bad. Well, I want antibiotics. Maybe. It's annoying that you have a cold, but give it 2 or 3 days more, and of course keep an eye on it. If it gets worse, then you can still get them, but be a bit patient, let your body heal. But then that's a completely other story than if you're in a small child. If you have a small child with a massive ear infection, I also gave my daughter antibiotics because she was sick for weeks. So sometimes you can't, because then it can get worse as well. So you have to have that decision, and even an ear infection can become really troublesome as well. So sometimes you do have to do it, but then we need more guidelines on when we need it, and also we need evidence to know if it works. Because
exactly. And you're touching on a very important topic, because antibiotics, let's remember, I mean, they can be life savings, and they extended the human health span. They actually helped lower mortality during childbirth, and they helped lower a lot of complications, especially for children. So they can be very valuable in the situation of an infection. but then because they kill bacteria, sometimes, I mean, they also kill the good ones. So we're left with this trade-off of are they really needed right now or not? And what do you think about how could we approach it practically? Do you think it can be a conversation with a doctor? Maybe we could ask questions and maybe pressure test. It happened to me before, actually, to ask the doctor, to be told you should take antibiotics and to ask back, well, is there another thing we could try? And I think, as you say, it's much easier on an adult, and especially because you can feel if things are really getting worse. So how could we go about it?
Well, I think in the first place, we as doctors need to be more informed. I think almost every doctor now knows that we do have a problem with antibiotics and antimicrobial resistance and everything. You hear more and more the last few years also that doctors are more aware about the PPIs. That's something that 5 years ago, everyone was like, huh, is that harmful? Huh? There's still many people who have that reaction, physicians, and that they just are not aware that there are so many articles now showing that it's potentially. But then, doctors, they have to follow up on so many things. So it's also not that easy. So I also think there need to be policy, there need to be, guidelines. Like I recently read an article that there should be like antimicrobial stewardship, on hospital level, that they try to reduce it, on governmental level, national level, they try to reduce it, that they need it for PPIs. And so I think it starts in the training of the doctors. And I also, it's difficult sometimes. I think it's good that you ask as a patient or as a parent, like, do I need it, and to question it, and to ask. That's also what I did when my daughter was still sick. Like, do I really need it? What happens if I don't give it? And like in the Netherlands, they're already way more resistant. They will not give it immediately, but say like, you have to come back. Well, like in Belgium, as a Belgian citizen, I know the systems both in Belgium and Sweden. They would give it immediately, but then they may say like, oh, maybe you don't need it, but they already give it, so many people will take it straight away. So but then also, one of the things for antibiotics is also that you really have to listen to the recommendations of the doctor. If they say 5 days, you have to take it 5 days, not 3, because otherwise you increase the risk of antimicrobial resistance. But then if you can still argue with it, like, do I need it, or can I still wait for 2 days? And if it then indeed goes better, but it's a decision you have to make with the doctor, because they should know better. And I heard a colleague of mine, a gynecologist, complain that there were parents now who almost refuse life-saving treatments because they read something that, but it can affect the risk of autism. But then, if the risk the baby will die, that should be, it's a little bit more than what happens later on. First of all, you have to survive. And in neonates, especially very vulnerable ones, that's the key issue. In moms, it can be as well during pregnancy. But then afterwards, it's that gray zone that we have to work on. Is it really needed? What's going to happen if I don't take it? Are there alternatives? Can it get better with, 2 days sleeping and a bit more healthy diet and, taking it easy? Because we also live in a very pressured society, like, everything has to continue. And that's, for me, I must admit, also a reason why I grab for paracetamol when I have a cold, because, life has to move on. You just can't, take 2 days off in all situations. And then, so it's a bit of a balance. But most of all, I think it's good to have the conversation. It's also important to talk about it and with your physician, with and it's important that you look for help. And the doctor will know better if it's because as a patient you cannot. Even me, if I'm sick and I'm a doctor, if I'm really sick, I can't assess if it's serious. You're sick. So and then you need a doctor who they have a better gut feeling and like, is this something serious or not?
Yes, definitely. And we completely share that point of view. I think we always need to be balanced and not have further risks. It's not like we would ever say, completely refuse antibiotics at all times because they affect the microbiome. We need to be aware of what's the acute problem you have right now. They can be life-saving. And of course, having an infection that goes on for a long time can also have long-term effects. So we need to be balanced here and always listen to the doctor. And the main point here is to ask questions and take an informed decision, and maybe ask if there's alternatives. And the other thing is also that it seems that antibiotics don't all have the same effect on the gut microbiome, because there's some that are more broad spectrum and some are more targeted. So what's your view on that? Is that also a question of like which kind of antibiotics could help?
Well, yeah, the type of antibiotic is more, in general, more the thing that is really important in the hospital as well, because then you need a bigger choice. So most mild infections that you treat in an outpatient setting, you have less choice, and but it's indeed some of the antibiotic groups are more notorious considering effects on the microbiome, but it's also not as straightforward. And a large some drugs are really, some antibiotics are really common as well, so there is then more evidence, so it's not such a straightforward answer. But yeah, we need indeed look also in our research. We need to look into the different ones. And what I also wanted to add is, even if you use antibiotics, if you are better, you can still work on getting your microbiome better in shape as well. So there are probiotics. I'm not going to say anything about the efficacy of them, but also healthy diet and just taking care of your lifestyle, that will also be important. And I think that's sometimes also a bit neglected. Like, if you, for example, are a smoker and you smoke every day, that's also bad for your microbiome. Even if you take then probiotics or whatever thing to make them better, you're still exposed to a not so good thing as well. So I think our gut microbiome is a work in progress to keep it healthy and balanced.
Exactly.
And if you have like antibiotics or other things.
I love that you're bringing this up, because that was going to be my next question. What can we do? And actually, our last live was with a clinical pharmacist about probiotics and the evidence on antibiotic-associated diarrhea in children and antibiotics. So we have that live. We have the recording also on YouTube if you guys want to check it out. We talked about that, and we talked about also the opinion of the European Society of Pediatric Gastroenterology. So we cited what the doctors at the European level say. So that's a great point as well. And so these are antibiotics. And of course, as you say, I think it is more known that they have an effect on the gut microbiome. And then you talked a lot about PPIs. So maybe the first question is, what are PPIs and when are they prescribed, so that everyone in the audience also associates them to maybe a type of medicine that they've been taking potentially?
So we have, our stomach is a very acidic environment, because it's a bit of a barrier. Everything that we eat and are exposed goes basically through, can I say, a shower of acid or a bath of acid before it goes down. And that's one protective way of also making sure we don't get pathogens into our system. But sometimes we have too much problems with that acidity, and then you can get gastroesophageal reflux that comes back in the throat, and then you have that nasty feeling in your mouth. Or you can also have a problem with gastric ulcers, or H. pylori is also a bit of a bad guy that PPIs are used for to get rid of it. Also, if you use drugs like anti-inflammatory drugs, it might be that you use PPIs. One of the most common ones is omeprazole. And then you use omeprazole as a gastroprotectant to protect your stomach, that you won't get any ulcers. I think the prototype of patient is the middle-aged man who eats a bit too much and drinks a bit too much and is a bit too heavy. But we see that it's actually in all age groups, it's more used in women. And the worrying thing is that the use has been going up dramatically all over the world. It's among the top 10 most sold drugs. And initially they were very restrictive when it came out in the 80s, because they knew it's such a potent thing that shuts down acid production almost entirely. So then they were really, careful and everything. But then gradually, they were a bit looser, and then it became over-the-counter available, became available in the supermarkets. It was not only like for proven gastroesophageal reflux, but also with gastrointestinal discomfort. And then you hear it already. So then it's not really clear why they use it. And yeah, there are numbers of up to 50 to 70% of the people who use it don't really have a proper indication. And most indications are that you only use it for a couple of weeks.
Mm-hmm.
But then there are a few indications like Solomon-Ellison syndrome, where it's a disease, a syndrome actually that you have, that you produce too much acid, and then you need it lifelong. And like in small children, it's also the recommended treatment in esophageal atresia. So if you don't have a full esophagus when you're born, and congenital diaphragmatic hernia, that's also really bad congenital malformation that needs surgery early in life. And those kids do get it. And it's international recommendations that they get it for a long time. But then also questionably, we don't really know if it really works. But then it's also in kids, it's often given for like, if they don't really know why a baby is crying or not sleeping well, they think, oh, it might be reflux. But then again, efficiency is not always as strong.
Yeah.
And that's a thing that worries me a bit. Also, like, if you start prescribing a drug like in a young adult and you have vague gastrointestinal symptoms and you just give a pill and you keep using the pill, then it might also be a sign for something else, for something worse, for example, cancer, which is then not explored. So that's also one of our worries as well. So in kids, if we go back to then the kids, it's some physicians will prescribe it quite easily because a kid, it's probably reflux, let's take a pill. Without properly knowing, like, is there actually a real problem? Is there really reflux? Because in children, it's also, everything is still developing, and it's a normal thing that if a baby drinks, that the milk comes up once in a while. It's just a normal physiological process. That's not illness. It's not a disorder. It's a normal thing. And so for milk just coming back up, if it's, every baby does it. Every single baby does it. And that should not be an indication for PPIs.
Exactly. And I think like you bring up a core issue that we have today, which is ideally we should be able to try to understand what is the root cause of a certain problems and try to fix that.
Yep.
Instead of taking long-term medication. And I say that also having studied pharmaceutical engineering, I worked in pharma companies, and medication and pharmaceuticals can be amazing tools for acute, time-limited concerns. But when you take a medication for a long time, first of all, you haven't fixed the root cause of a certain problem, so it's still there, it's still bothering your body. But also medications, there is no medication that doesn't have side effects.
Yep.
All of them do. All of them have other effects on the body. So it's quite an issue today that we rely on medications long term, and as you say, sometimes without proper evidence, and a lot of times going against what's really written in the brochure and in the indication. Most medication are supposed to be taken for a time limited amount of time. So that's very interesting. And you're saying so for children, and especially also for newborns, PPIs are prescribed sometimes for reflux. What are the other medications that are commonly prescribed in this age range, for example, for maybe constipation or infections and other concerns?
I was indeed also I was initially not aware that there were so many anti-constipation drugs used in babies as well, which is also normal that the system has to develop. And a baby starts with milk, ideally breast milk, or if it's of formula. But then of course the gut and the body and the gut microbiome need to adapt to introduction of new food. So it's a normal thing that, sometimes you have diarrhea, and sometimes you have, so it's not even, it's not related to any pathogens if you have, necessarily if it's, sometimes it's a bit more fluid and sometimes it's more hard, so it's also not a reason to, immediately go to drugs for constipation. Of course, if a baby is truly constipated for days
Yeah.
on a row and weeks in a row, but then my initial idea was also like just try fruit first and see what can happen there. Does the baby drink enough? Is fruit intake enough? Is fiber intake enough before you go to the drugs? Because indeed we don't know, there is not that much known yet on how constipation drugs affect the microbiome, but it makes sense that they will, because they change the speed of your, the food and
Yeah.
the way how it looks like, how long it stays inside the body. And the same, so if it's changed at transit speed, it will affect the bugs that survive. But then, yeah, it's not that on children. I don't think there is any evidence yet on how it affects the
Yeah.
microbiome. But then I'm also more a bit of that precautionary principle. Like if you don't really know the evidence, don't take it like candy. And try other things first. Don't just, but it's a bit our attitude as well, because if we go to a doctor, we are trained, we're just conditioned to basically to ask for drugs, and the physician is conditioned to do something, and that's mostly indeed prescribing drugs or prescribing something else, and just advice is often not, many people would not be happy with it. So it's also a bit that mindset that has to change, that advice is helpful as well. But then, I'm also worried indeed about the number of people, small children who get antibiotics. PPIs are also in, but then now I'm also thinking about the kids between 5 and 10 that we saw recently in our results, that the use is going up because we don't see an increase in the indications, the approved indications. And antibiotics, I don't know, it's scary that you see that 1 in 5 children uses antibiotics in Sweden. I always considered Sweden as one of the better countries considering prescriptions, but that's still, even in pregnancy, 1 in 4 women get antibiotics.
Yeah,
That's
it's
enormous.
still quite high. What about PPIs? What is the evidence on the effect on the microbiome? Is there any association to risks later on?
Yeah, so we do associations. So we have several indeed that we and many other groups have linked it to several events. In the children and the mothers, also risk of cancer, but then that's indeed population level, and it depends a lot. Like in pregnancy, it's only like globally it's around 1 or 2% who uses PPIs, but in Sweden it's already 3.5% the last few years, so it has been increasing. It's also quite unclear why. In considering the microbiome, we did a study ourselves, a small study on how it affects the microbiome, but only in like 10 children. And as epidemiologist, I like big data, so I was actually surprised that we did find something, but that we also still divided them and compared them to other babies. But we did see a stronger effect, less diverse microbiome in those kids who were exposed the most. And I was actually surprised that we could see something like that on such a small cohort. But then, of course, those findings are not linked yet with later health, and there are so many factors affecting our health on the way that it's not always as easy. That's the same thing in our association studies. It's not that easy to convince everyone, like, this is something. But then indeed, we need more studies, different studies. And that's something I always liked as an epidemiologist, that at one side we do have our big registry-based association studies that we, look at the whole entire Swedish population, like our cohort of 1.5 million pregnancies in Sweden. And then we find things, but then in the meantime, we have our other studies, like our Sweden Mommy study, like an infant cohort that we started, that we collect the information, that we will see like what happens now on that microbiome, if, directly. And it seems that, it's nice to look at basically the same hypothesis in different ways. And it seems that, the evidence is quite convincing that something is indeed happening. And, but then, there are probably drugs which are good for our microbiome as well. I'm now thinking first, yeah, like if it's anti-inflammatory, yeah, we know inflammations are not good, but then again, we don't have enough evidence yet on really, we should not start taking, for example, anti-inflammatory drugs because it might be good. I think we should just change the mindset a bit, like we don't always need the drugs. Do we need them? Do we need them that long? Do we need them in such high doses? Are they
Yeah.
guided? Are there efficacy data? Do we know anything about long-term safety?
Yeah.
Um,
So basically, to summarize, the general principles are to have a conversation with a doctor and asking, do I really need it?
yeah,
The second one is, do we really need this one, or there's
yeah,
something lighter, perhaps? And the third one is, if we need it, let's stick to the
yeah,
indication and to the time
yeah,
and to the dosage that is prescribed, and not take it for a long
yeah,
term. And then if they have to be taken, there's number four, then would be there's things you can do
yeah,
to restore and take care of gut health, as we said, probiotics, and we have a live on that, and in general, diet and lifestyle to really take care of the gut. That's really informative. And what about paracetamol? So in Sweden, it's called Alvedon. So what about that? It's also a very common medication.
yeah. I heard more and more indeed people questioning about it. The unfortunate thing for me as a researcher is that it's not on prescription, so we don't have it in
Right.
on our fantastic Swedish prescribed drug registry. So people use it over the counter. We do have information in the birth registry for some drugs, but then still mention it if you just took one paracetamol. So there is little evidence, but I've heard also from association studies that there are some concerns indeed. But yeah, so it's indeed more a thing like we need more evidence.
It would be
And
interesting to look into to look at that in our prevent study,
yeah,
because as many of you know, we have almost 300 families in Sweden that have helped us collect gut microbiome samples from their children, and we have extensive questionnaires on the use of medication. So one of the topics we'll be looking into with Nele and her team
yeah,
will be on the use of medication and whether we see any changes in the gut microbiome. So hopefully we'll get new insights right there. What about vaccines? So many people reach out to us
yeah.
asking us, can vaccines affect the gut microbiome? What do we know about that?
Yeah, I was actually surprised with the whole pandemic that that whole anti-vax movement grew so much, because we suddenly had like a real pathogen killing people, and then suddenly people questioned, well, vaccines, they have really, I think, yeah, in infectious disease or healthcare, antibiotics and vaccines have saved millions of lives. And of course, we don't know everything yet, but then, and vaccines, of course, they can have side effects. But then, if you then compare, yeah, I think the likelihood that the vaccine has a long-term effect is lower than if you take a drug every single day for a
Right.
prolonged life. Because if you just already think logically, a vaccine is a tiny dose compared to if you take a pill every single day, accumulated, you have a way bigger exposure for a very prolonged time. And then again, yeah, we have to think about, the short-term effects as well. Like childhood diseases like measles, they kill. They have, that's why, the generation of our grandparents, that there were so many kids dying at the same time. We don't know it as a physician anymore, but those infections, they really killed kids. And okay, it may not be your kid, but if your kid is not vaccinated, it may be the kid's best friend in school. And then, yeah, for vaccines, we really need that herd immunity to keep everyone safe, also the kids who are not vaccinated. So, but yeah, there has been some research also. Vaccine, it has the active substance and also other things in there to deliver the vaccine. So there is some research going on indeed, like what are the toxic effects, and sometimes it could be that you react on those things. But then I think in general, really the benefits really outweigh the risks. And we do have our vaccination programs in Sweden, in Belgium, and it's not only your child's health, it's the health of everyone, and you also don't want your grandma to die from a childhood infection. Um,
And I
but
think you're touching upon a great concept. And for me, also having studied pharmaceutical engineering and having worked with pharmaceuticals, the way I like to see it is that it's a trade-off, and there's benefits and there's risks. And all of these benefits and risks need to be put on the scale and then understand for
yeah,
your situation what's the best, right? And one of the things that not a lot of people are aware about is that infections and viral infections and any kind of infections can also have effects on our health,
indeed.
even long term. What do we know about that?
Yeah, well, yeah, if you think like polio is a disease that we thought that was extinct, but now in Gaza it's popping up again. It's only 1 in 100 who gets really infected who gets disabled. But then, polio, it's, you become a handicapped person. You can become a handicapped person and die very soon. So that's like real risks. But almost all of those childhood infections, they can have serious morbidity that your kids get into the hospital for prolonged times. And yeah, if you see on what scale vaccines have been delivered globally, the risk of really side effects is tiny compared to the benefits.
Right.
Yeah.
And that was also, I think, then to wrap up a bit this topic, I think we also did a literature review and looked at the impact of vaccines on the gut microbiome. And our conclusion was that there isn't much evidence because there aren't much studies. So
Yeah.
we couldn't say like it's good or it's bad. That's one thing. And then, as you said, you always need to put on the scale kind of the benefits and the risks and talk to your doctor about it. But then, as you said, there's many things that affect our gut microbiome. But the question is, what are the things that you get exposed to every day and that kind of affect you every day? So I really agree with your point of view. I see there's also a question in the audience, which is about lactulose for constipation.
Yeah.
So they're asking, what about lactulose for constipation? I read that it can be functioning as a prebiotic.
Yeah. I don't know that much about pre and probiotics myself, but I think lactulose it's also a quite simple compound. It's not a composed product with many things in there, and basically it's just some sort of a sugar molecule. And how it works for constipation is that it attracts water into the gut, and then everything goes faster. So it's not, it should not have an impact on the rest of your body, which is a good thing. But then, so it could indeed, it's a sugar, and bugs, many bugs like sugar. I'm thinking, real bugs as, outsourced bugs as well. So for me, it sounds less harmful than things that, completely shut down, like a physiological mechanism like gastric acid production. But then, there is also indeed on the microbiome, it's not that much data out there, but I would not be that worried myself on lactulose. And in this, maybe it's a prebiotic, maybe it's a good thing. Some bugs may like it, others may hate it, and hopefully it's the good bugs who like it and the bad bugs who hate it. Because the bugs who have a lot of food, they will survive, and if you don't have food, they die. Yeah.
Thanks for the question. Maybe we can look into that. Usually when we get questions and we cannot answer right away, we just take a quick look at the literature. So we'd be happy to follow up on that. That's great. I think we touched upon all the main medications, so antibiotics, PPIs, paracetamol, and vaccines. Are there any other medications that are very common in the first years of life that you think are worth mentioning?
Well, you have skin products as well. Often kids will, it's also not my area of expertise, but it's many kids will be exposed because, it's also very common that there are some skin issues as well. And especially in a very vulnerable, very thin, baby's skin is thin, so it could be that they have a systemic effect and end up in the gut. But as far as I know, I didn't see any studies. I don't think there are any studies looking at how skin products affect the gut microbiome.
Right, you touch upon a very used pharmaceutical, which is cortisone, especially for eczema and other skin rashes. I used to work actually in eczema research and testing cortisone products, and I've had it on me many times because I have eczema. And yeah, one of the things that really surprised me, and I knew working in that field, is that cortisone is supposed to use in very tiny amounts. There's a fingertip kind of guideline, and also it's not supposed to be used more than 10 to 14 days, while it's very common to use it sometimes on the entire body and for extended periods of time, and that can have quite significant side effects. So if you're using cortisone on yourself or on your child, that's one thing to keep in mind. It's what we discussed, so to stick to the indication.
That should certainly be under medical guidance. Don't try, because that clearly has systemic effects. And
yes, because it is absorbed, even if it's on the skin, it is absorbed in our body. And I had severe problems actually with that as well, because it's very common to use it for eczema. So that's yeah, that's also great that you bring that up. So, and also great that you bring up the topic that, you know, just because something is on our skin, it doesn't mean that it will not affect the rest of our body as well. It will go into the bloodstream and then affect everything.
Yes.
And great, I think we touched upon all the main topics, and we recapped also what you can do in your daily life. Let us know if you have any other questions. I would like to close also on our PREVENT study, because as I mentioned, we're doing a study in Sweden, and we're collecting information that Nele and her team are also going to look at. What do we hope to find out there? What will be the topics that you will look into?
Well, yeah, I really like to explore how those drugs affect our microbiome, and also like our risk of infections. So, you know, those stupid, annoying, mild infections that, you know, wipe us off our feet for a few days, because we know so little about it. We know a lot about those major infections, of course, but then for me, I'm also indeed thinking, you know, especially if you are a parent of young children, you know, the VAP system, that you have to be, you know, at home for a few days because it's yet another cold or yet another diarrhea. So that's something that really interests me. Also, weight gain, it's also an issue. It's remaining an issue. We have sufficient food, have everyone, but then it's not always a good food. And how can we make it that their kids are off for a good race, and that they are, you know, starting their lives healthy, because childhood obesity is the main risk factor, or adulthood obesity. I also really, in the beginning I thought it was a bit like far off, but you know, the neurodevelopment, indeed, how the brains develop and the gut, there are still so many unknowns to be explored, and it's indeed a very sensitive thing. I know also with the outcomes like autism, ADHD. And then as an epidemiologist, I'm very aware that we also shouldn't scare or, make people feel guilty about, you know, being exposed. There are, everything that we have in our health is multifactorial. There are always many factors contributing together. So you should never be, you know, if there is something harmful, you should never feel guilty about it. And like if you took something during pregnancy, or if you did give a drug to your child at a certain time, it's also based on current knowledge, and we need more knowledge. But I think the early life field, the women's health field, is so important. It's so interesting. We lack so much. we need more data. It's especially, both of them, women's health, early life, it's important for everyone. We all have moms. Most of us have kids, so many of us have kids. And it's important that, everyone is healthy from the start.
Exactly. You touch upon a really good concept, which is life is not perfect, and nowadays we're exposed to many things that maybe are not optimal. We're still at a time where health span is highest, and you know, if you think even 50 years ago or 100 years ago, it was common to die during childbirth. So this should not be a source of anxiety. It should be a source of empowerment. And as we say at Alba, knowing is beautiful. That's really our phrase, and we're all about knowledge and trying to understand what do we know about something, and what are the choices that you can take and that are in your power. What are the questions you can ask, and what are the things you can do to support gut health afterwards. The other thing that you said is that this affects everyone. So it really seems that, for example, antibiotics are associated to, for example, obesity or asthma later in life. If this is true, and it also seems some studies even show that we're losing diversity in our gut microbiome over the generations. Some even link this to the rise in chronic diseases. So if this is true, this is affecting everyone at a generational level. So generation after generation. So it's also, that's also why we do it at Alba and why we took this mission, because it has impact on human health more broadly. That's also why we do the PREVENT study, which is one of the largest, like very detailed studies on child gut microbiome.
And yeah, what I often use as an expression is the baby steps. With baby steps, we move forward a little bit, our own health, the research field, and we can't do everything in, at once. But yeah, knowledge is expanding, and yeah, hopefully it has an impact.
Perfect. Thank you so much, Nele. This was so interesting, and I also learned new things. So I always love to learn new things in the lives. And thanks so much for everyone in the audience for the questions and for listening in. And yeah, have a great weekend and rest of the day. Thanks so much.
Thank you.
All right. Bye, everyone.
Bye.
Bye-bye.